Okay, now we're going to assess your ears. I'm just going to look at the external features of your ears, just make sure that they're symmetrical on each side. I'm going to go ahead and have you turn your head, and I'm going to look at the external canal and just look for any signs of drainage or inflammation on each side. And then I'm going to go ahead and do a whisper test, which is just going to check your hearing. So I'll have you go ahead and occlude one side of your ear, and I'm going to whisper a 2-syllable word into the ear, and you tell me what I said. So,
baseball.
Perfect. And then include the other side. Perfect.
Peanut.
Good. Okay, and then normally I would do an inspection of the internal canal of the ear. I would take a speculum and probably get one that would fit most comfortably, so the largest one that I could find that would be the most comfortable for you. I would pull the pinna, which I'll do it on this side, up and back to view the external canal, and I would use the otoscope, shine it in there. I would look at your tympanic membrane, and then the specific structures of the tympanic membrane, including the bony prominences. I would check your light reflex, assess for any redness. It should be a nice pearly white color. I'll go ahead and assess your nose now. I'll look at the external structures, look for symmetry, any shift away from midline, and then I'll have you go ahead and tilt your head back. Perfect. And then I'm going to use my hand and hold your nose up. And normally I'd use a speculum to assess this, stick it in your nose, but I'll just use my pen light for right now. And then I'm going to go ahead and look at the mucosa, your septum, and I'm looking for any redness or any septal deviation. Perfect. And then I'm going to go ahead and plug one side of your nose and just check your patency. So breathe in. Perfect. And then the other side. Good job. Okay, so now I'm going to go ahead and assess your mouth. I'm going to check the outside first, look for any dryness, any lesions. Go ahead and open up your mouth for me. And when I do this, I'm going to go ahead and check all of the different features inside your mouth. So I'll look at the subbuccal mucosa, I'll check your teeth, your gums, your tongue. Can you lift your tongue up for me? Perfect. Check the underside of your tongue. I'll look at your soft palate and your hard palate. Can you stick your tongue out for me? Say ah. Good. And then I'm going to assess your uvula, make sure it's midline. I'm also going to check your tonsils and then grade your tonsils, which those look like a 1+. They're only occupying 25% of your oropharynx. So then I'm going to go ahead and assess your neck. I'm going to assess the external structures again, looking for symmetry. I'm going to go ahead and feel the trachea, make sure that it's midline. I'm going to go and palpate your lymph nodes. So I'm going to go ahead and start on your face and move down your chin. And I'm going to go ahead and assess your lymph nodes under your chin and work my way up to the tip of your chin. Good. Any tenderness at all?
Mm-mm.
Good. And then I'm going to go down the front side of the neck and palpate. I'm going to be feeling for like pea-sized lymph nodes, maybe a little bit larger, looking for anything that's hard that should be freely movable. I'm going to go down the back of your neck. Okay, and then feel the back of your head. Just looking for any kind of tenderness, anything that's firm. Now go ahead and go above your clavicle as well. And I'm going to turn your head this way. Perfect. And then feel down one side of the neck. And then turn it the other way. Okay. Perfect. And so nothing tender on anything that I felt so far. Perfect. Okay, now I'm going to go ahead and palpate the trachea. I'm going to move it from one side to the other. And this can be a little uncomfortable for you, so sorry about that. And then I'm going to feel for the thyroid. I'm going to move it from side to side, looking for anything out of place. Okay, now I'm going to go ahead and check your range of motion in your neck. So check your chin. There you go. And then roll your head. Do a head roll for me. And look for just the full range of motion. Can you go the other way? Awesome. And then I'm going to check your muscle strength in your neck. So push against my hand. Good job. And push against it this way. And then forward. Great. And back. Awesome.